Pullman Regional Hospital's Center for Learning and Innovation introduces the Social Work Extender program, designed to identify barriers to health faced by populations in rural Whitman County, and to guide patients to access the right care in the right setting at the right time. This community-based healthcare model addresses the barriers of low income, disabled, and a growing aging population with multiple and chronic health issues. The Social Work Extender program evolved out of increasing requests from primary care physicians in the community who were reaching out to the hospital-based social work department, requesting our services and assistance in following up with their patients, and provide the students seeking internship experiences a meaningful opportunity and a way to give back in the community. The Social Work Extender program provides outreach to underserved populations while providing WSU human development students with a meaningful internship experience. Thanks to a $77,000 grant from the Empire Health Foundation in Spokane, Washington, and a unique collaboration with Washington State University, human development students are serving internships as social work extenders with Pullman Regional Hospital Department of Social Work.
As a busy family physician, they're a great benefit. I always think of when I'm in the hospital and I have a patient that's real complicated and stuff, and it's time for them to look for resources in the community. I mean, I do a social worker consult, and so it's the same thing in the outpatient setting, except I'm in a 15-minute visit. And here I have a patient that has needs that need to be met almost at the same magnitude as they do as an inpatient. And so I don't have the time, I don't have the resources, and to be able to turn them over to a social worker extender and have them with the resources and the knowledge and all the ins and outs, to be able to plug them into the resources that are out there. I mean, it takes a weight off my mind. It makes it so I'm not spending time trying to do that. And it's a great benefit.
These efforts address healthcare priorities such as lowering the cost of care, improving quality of care, and have the potential to increase the length of time people may live healthy and independent lives in their own homes.
Some of the people that we have met weren't quite sure how to start conversations with their doctors or their healthcare team about what's important to them in terms of maybe it's medications they don't know how to ask for, or just they don't even know how to schedule an appointment, or they don't really feel confident in doing so. Or just also maybe they have questions about transportation services. Some of them might be food insecure. They don't know where their next meal's coming from. So I think just our presence has kind of helped start a conversation that hopefully will help them become more self-efficient in the future.
We want to hear what's working really well for them and maybe what's not, so that we can try and see if there's any barriers that need to be addressed in them achieving their personal health goals.
Socioeconomic status and living conditions are key determinants of health that can directly or indirectly impact a person's ability to manage a chronic disease or prevent a new disease. A study conducted by the Organization of Economic Cooperation and Development cites that 20% of what determines health can be attributed to actual health care, another 20% to genetics. The largest percentage, 60%, is attributed to social, environmental, and behavioral factors. Social determinants include the availability of safe housing, accessible transportation, and the availability of fresh food. The Pullman Regional Hospital social work extenders serve at Pullman Family Medicine, a primary care clinic in Pullman, the Palouse Free Clinic in Pullman, and low-income housing facilities including Pioneer Square, Kenwood Square, and Palouse Cove. The students also serve at Whitman Senior Living. Part of the training that they receive is hospital-based orientation. They go through background check and screening and interview process. And once they're selected into the Social Work Extender program, they receive an 8-hour training from Better Health Together. Two of the tools the students are trained in include the My Health Matters booklet. Within the booklet, the client is able to write down what is important to them as far as taking care of themselves. The next booklet includes My Action Plan. They can indicate what their personal goal is. The ultimate goal is to improve health outcomes, striving to keep people in their own home setting. The Social Work Extender program provides outreach to rural, aging, and underserved populations in Whitman County while providing WSU Human Development students with a meaningful internship experience. The Social Work Extender program is just one way Pullman Regional Hospital's Center for Learning and Innovation is creating pathways to a healthier future.